I want to give a word, reach out to our staff that's here tonight. Without them, our support staff, this wouldn't all be possible. In addition to myself and Dr. Romani, we have a new associate, Dr. Schmid, who's with us over today. Our licensed medical esthetician, Melissa Galloway, is here. And 3 of our registered nurses, Michelle, Maria, and Mary. And our patient representative, Nancy DeLuca. Ultherapy is the only FDA-approved non-invasive procedure to lift the skin of the neck, the chin, and the brow line. It is not surgery, it is not a laser, and it is not an injection. It is an ultrasound treatment. It uses ultrasound to guide the clinician to the direct area that they want to treat underneath the skin. We are going to do a live demonstration midway through our presentation. Using the Ultherapy and ultrasound, we are able to locate the exact area underneath the skin and the tissue that we want to treat. Then, by not radiation, but ultrasound waves will heat up the area of tissue that we'd like to treat. This causes some alignment of the collagen and tightening of the face and tissue. How does it work? Again, it's an ultrasound energy, which is non-invasive. In other words, there is no effect on the outside skin whatsoever. It bypasses the skin and heats the deep tissue. After the procedure, there is no evidence that the patient has had anything done in terms of any redness or injury to the skin itself. It is a natural regenerative response to heat generated on the deeper tissues. It stimulates the growth of new collagen, and by doing so will lift and tighten the skin over time. This compares Ultherapy to 2 other modalities that are treated to treat the aging of the face. One is RF, which is radio frequency, otherwise known as thermage, and another is laser therapy. We can see that Ultherapy has several advantages. When Ultherapy is used, the temperature is in the optimal range, between 60 and 70 degrees, and that is the temperature range at which Ultherapy works. You can see the other 2 therapies, lasers are usually a little too hot, and that's why they cause an effect on the skin, and radio frequency is a little bit suboptimal. The depth of treatment is also very precise. When we're using Ultherapy, there comes in several different hand pieces, and we can actually set the hand piece and the treatment to the layer and depth that we want. So in a patient that has very thin skin and tissue, we can go more superficial. Particularly in men or deeper areas of the face, we can get the therapy to go deeper into the tissues to the area that we want. When we use a laser, it usually is just right on the skin or just below the skin, and that's why there's skin damage. With Ultherapy, there is no skin damage. Thermage is kind of a blast treatment. It just kind of treats the whole area. But Ultherapy is much more precise. And you can see we can deposit these little areas of energy to the exact location we want underneath the tissue, and by heating up these areas, it will cause recollagenization. The options for aging of the skin and soft tissue are as follows. Do nothing, age gracefully. Many of us don't want to do that. Non-invasive treatments, such as injectables, such as Botox and fillers. Laser therapy, which is, again, more towards addressing the outside or surface of the skin. Or Ultherapy ultrasound treatment, which addresses the deeper tissues. And, of course, surgery. Ultherapy is not an answer for surgery. It is for people that do not want to proceed with any type of surgery, such as a facelift, but they want a non-invasive treatment to try and address their facial aging. Who is an Ultherapy candidate? Again, it's patients that do have some laxity in the skin and soft tissue of the face. They have some fat distribution, which they're unhappy with. They've got some wrinkles and crepiness of their skin. Really, any age is good for Ultherapy. This is particularly good in the younger patient who has just early signs of aging and is not a candidate for surgery yet, or sometimes in the older patient does not want to undergo surgical treatment, wants something less invasive. This is also a good treatment for people that may not be a candidate for facial aesthetic surgery, such as smokers or people that have other medical issues. The most important thing to know about Ultherapy is to have realistic expectations. Some patients benefit from more than one treatment. The majority of patients, one treatment is all that is needed. Ultherapy is not intended to produce, again, the same result as invasive surgery. This is not a treatment that will last forever. The collagen that's produced by Ultherapy lasts forever. However, we do continue to age, and sometimes a secondary treatment may be needed a year or 2 later. The benefits, again, of Ultherapy are that it's non-surgical and non-invasive. There is no downtime. You can go back to your regular activities as soon as you leave the office. There's no evidence that you've had any type of procedure done. It is a proven ultrasound technology. There's no radio frequency. There's no radiation involved. It's all by ultrasound. It gives very natural and gradual results. When you leave the office, most people will have a little bit of swelling maybe for a day or two, but the results usually take 3 to 6 months for that new collagen to form to get the tightening. It's not something that is seen right away. It is convenient, and it is done in the office over a 1 or 2 hour period, depending on the amount of areas to be treated. There is no aftercare or restrictions. As I said, most of the time this can be done in one treatment, and the results are visible, but yet invisible. Ultherapy has gotten a lot of play in the media, as you probably saw in that loop that was playing when we came in here. Besides the housewives, a lot of other famous people have had this because of the downtime is so quick. There is no downtime, essentially, and they can go back to their regular activities and without anyone knowing that they have anything done. I'm now just going to have my partner, Dr. Momeni, come up and talk about some of the before and after pictures.
Dr. Hines has given you a good background about what Ultherapy does and what it doesn't do. What I'll try to do is I'll go through some example slides of before-after pictures just so I can demonstrate very specifically what these patients were after, what they achieved, and specifically I'll talk about what they didn't achieve. So let's think about this first patient. This first patient, all the befores, just in case you haven't looked at before-afters, by convention, befores are always to the left and the afters are always to the right. So if you can't tell the difference, then I have a much bigger problem than I'm dealing with here. So if you take a look at the before picture in this patient, you'll notice two things right away. One is that she has a little early sagging of the side of the jowl. So where the chin goes out to join the ear, it's no longer a smooth, nice line that it was probably 10 years ago, 15 years ago. Lower down on the neck, what you'll notice is that she started getting some, what I would call transverse sagging, meaning she's got lines that run from side to side. I'll show you other patients who have a different pattern of aging. We all age very, very, very differently. And one of the important things in trying to think about how a doctor will try to approach anybody's aging is to make sure that the treatment is individualized. If you try to do exactly the same treatment for every patient that walks in the door, what you'll end up is you'll get some really incredible results. They'll send all their friends in saying, this guy is brilliant. You'll get a bunch of people who got no difference whatsoever, and they'll go to church that Sunday and say, this guy's a real crook. And you get a bunch of patients in the middle that maybe get a difference or maybe they don't. But that doesn't really lead to a very successful practice for us or a very happy set of patients outside. What we do on a day-to-day basis is we try to talk to patients, find out exactly what it is they're concerned about, and then try to see in the long and large toolbox of stuff that we have, what we have that might fit your needs. After Ultherapy, and we'll demonstrate what Ultherapy does, but I want you to just focus a little bit on the before-after pictures and the differences. You'll notice two immediate things. If you compare the jowl to the jowl, you'll notice that she is once again smooth. And if you compare the neck to the neck, you'll notice that she's not line free. It's not a perfect neck. It's not a 19-year-old neck, but it's pretty good. Remember what Dr. Hines said. This patient had no downtime, no surgery, nothing injected into the skin. The old dictum my partner always liked to say is you get what you pay for. If somebody wants to have something that is nice and cheap and easy and no downtime, then you can't really expect perfection. So let's go on to another patient. A little bit different. So what you'll notice on the patient is that she doesn't have that kind of sideways lines that developed on the last patient. What you have here is you have much heavier sagging of the jowls. This is a patient who has more tissues under the chin, and she wants to have the area improved. Now, I can tell you that before Ultherapy came out, if this patient came into our offices 2 or 3 or 4 years ago, the only thing that I would have in my toolbox to offer to this patient would be maybe liposuction underneath the chin. We know that Ultherapy, even though they're not FDA approved to say this or market this, we know that Ultherapy, the heat, not only causes tightening of the skin, but it actually does kill fat a little bit. There's actually a lot of research going on about how you can kill fat underneath the skin without actually having to put any instrument under the skin. So this is one of the side effects, if you will, of Ultherapy. When we see patients like this, we actually start to get a little bit excited about Ultherapy because this is not all from skin tightening. That's too much to expect from skin tightening. This is actually a little bit of fat loss. You'll also notice that all of these pictures are taken 90 days after or more. And the reason behind that, as Dr. Hines said, is that the collagen buildup that happens doesn't happen overnight. It actually takes about 3 to 6 months to happen. So we won't show you any after pictures for Ultherapy that are 2 weeks old because they would look exactly the same. Now, this is a remarkable result. I would not ever promise a patient that comes in with this type of neck that they would have this type of result. but it's important to know that it does happen and it can happen. I'll talk a little bit about Ultherapy results and the variability later on. But this is someone who comes in, and she's chiefly interested in improving the neck. Now, notice the jowls. She didn't do anything about the jowls. No difference. Look at the neck. She treated the neck. There is a difference. And so internally, this is almost like a controlled study to see what you can get with the same patient. Another patient, a combination of the stuff that we've been seeing. We're showing you all of the neck pictures first. This picture is taken 6 months later, so it's showing you a pretty good result underneath the chin. This is a jowl treatment also, so this patient decided to treat not only the jowl area, which we call the lower face, but also the neck, which is everything between the lower face down to the collarbones. This is an important one to talk about. I wouldn't say this patient has a turkey neck or a turkey waddle. This is what's called the platysmal band. We all have a muscle underneath the skin of our neck, what's called the platysma. It's the muscle that if you tense up your neck, you see usually make bands on your neck. And the problem with some patients' aging pattern is that this platysma muscle becomes quite visible. One of the things Ultherapy does not do is treat the muscle. In fact, if somebody has a muscle band here that's very, very prominent, once you tighten the skin over it, which the patient did, the band sometimes becomes a little bit more sharply defined. So you might take a look at the before picture and the after picture and say, I love it, the skin looks a lot smoother. Or you might look at it and say, well, that band is actually a little bit sharper now, and you're right on both counts. So when we have patients like this, we always cancel them about this possibility. Now let's look at some side pictures. This is a combination of that little bit of fat loss and a little bit of skin tightening. I always joke with Dr. Hans that if I were to show this at a conference of plastic surgeons and say, look at this facelift I did such a great job, I would be laughed out of the room. They would think that this is not a very good facelift result. But remember, we don't expect facelift results from this treatment. We just expect a little bit of tightening, a little bit of lifting. That's all they're approved to do and all they're approved to say. Therapy is colorblind, it is gender blind, and it doesn't really care about age. So either it works for you or it doesn't. And when the FDA looked at it in their approval trials, what they saw was that about 90% of patients rated it as favorable, and about 8 to 10% of patients thought that, meh. So if there was a like button on Facebook for Ultherapy, about 90% of patients would press the like button, and 10% of them would probably just pass it by. The problem that we have as doctors is that we can't really take a look at a patient, you or you or you or you, and tell you it'll work for you, it won't work for you, it'll work for you, it won't work for you. That would be wonderful. That means that I would basically focus the treatment on everybody that actually needs it and not waste anybody's time or money on where we know it's not going to work. Now, sometimes it's obvious. If somebody comes in and their neck, like my great-grandmother, is hanging all the way down to here, that's a waste of that patient's time or money, and it's not really honest or ethical to try to achieve anything with Ultherapy from that patient. But as Dr. Hines said, patients up into their 60s and 70s have been shown to get good results with Ultherapy, so we don't really restrict it to a particular age. Another treatment, this is in that classification of if I'd done a facelift on the patient, this would be a really bad result. But for Ultherapy, this is an incredibly good result. Now, you'll notice that she's had a lower face treatment and a neck treatment. So you look at this before, you look at this after. Sometimes when patients come in for consultation, I show them this picture and I don't say anything. I ask them, what do you think about this picture? And most patients will say, that looks really nice. I really like that. And what I say to them is, you're a great Ultherapy patient because you're looking for the subtle improvement. Another patient might say, I don't know, that doesn't look so hot afterwards. That patient should never touch the Ultherapy device. They're looking for more improvement. They're looking for more of a result. That patient should really spend their time either doing nothing or talking more about surgery to see if it can give them a much better result. I won't say much more about these, but now by this point, you're kind of getting a gestalt of this. Neck treatment, jowl line. See how much better defined it is? Another neck treatment, very young patient. This is one of those patients that I was talking about that has a noticeable platysma band. Notice that the quality of the skin is significantly improved, but the platysma band actually becomes a little bit more noticeable. So this is a little bit of word of warning to the patients who have really thin skin over a really noticeable platysma band. Doesn't mean you can't do it. You should be prepared that it might be more noticeable. Now, we're showing you mostly neck treatments. Ultherapy is actually FDA approved for everything from your hairline all the way down to the clavicle. So they're FDA approved for the eyebrow, they're FDA approved for the jowl line, and also for the neck. And believe it or not, even though we're not showing you a lot of those results because we wanted to focus this talk on jowls and necks, some of the better results we get are actually with the brows and the eyes. A lot of patients feel that it really opens up around their eyes quite nicely. This is that hyper example of a patient who probably is not really a good candidate for Ultherapy. But she really didn't want surgery. So she went ahead and did it. And she didn't have that much of a result, so she went ahead and did it a second time around. And this is taken about 4 months after the second treatment. Now you're talking about a year later. This is another classic example of improvement, but remember, this does not tighten up the muscle. If you want to tighten up the muscle, we should be talking about neck surgery. This I would classify as a really, really great result for Ultherapy. If I could get this for every single one of my patients, I think we'd be very, very happy. We'd probably do fewer surgeries. This one's taken a long time, almost 8.5 months after 2 treatments. I would say the shadow underneath the jawline is improved. I would say the neck is a little bit improved. But this is one of those patients who probably did not get a very good result after the treatment the first time around, went ahead and did it the second time around. And I would say in the end, I would classify this patient as probably better off not having done it. I just wish I could know this the first time I meet this patient. But you'll notice for the patients who have a little lesser aging, the results are really magnificent. And this is 1 year later, showing that the results are still there. Another 1-year result. Let's move on to the eyelids a little bit. When we treat the upper face, usually we're focusing around the eyebrow. We actually do not treat the eyelid itself because the Ultherapy treatment goes about 3 to 4 millimeters in and 3 to 4 millimeters is within your eyeball. So we do not treat the eyelid, even though we're targeting improvement of the eyelid. So when you look at the before picture and the after picture, you'll notice that she had no eyelid before. Now she's got actually something where she might put a little bit of shadow on. This is an around the eye treatment, what we call the upper face treatment. The upper face treatment involves the area around the eyebrow, outside of the eye, and underneath the eye. So what you're trying to do is you're trying to tighten all the skin around the eyeball so that everything opens up a little bit around the eye. Takes away that tired look. This is a particularly good result. This is taken 3 months after. If you look at how much eyelid you see here and how much eyelid you see here, I should say that these pictures come from the Ultherapy company, and they have a particularly good technique for taking these pictures in a very standardized way, and they don't Photoshop anything. And I particularly like this company because they do not give you all of their good pictures. If you notice, I've shown you some results that I and they would classify as not so hot. But I think it's important for patients who are considering this sort of non-surgical technology to know that there's no guarantees with it. Another upper face treatment, really good result. This is a patient that we see all the time around the office, and oftentimes in our good, honest hearts, we may not want to do surgery on this patient. Yes, there's a little aging there. Yes, they'd be improved, but for the time and the money and the downtime you would put this patient through surgery, you may not even want to go through it. Even as a surgeon, you may not want to go through surgery with this patient. But it's really nice to have an in-between treatment to offer some of these patients who are really not ready or not suitable for surgery, but do really want improvement done. A really nice result for the upper eyelid. This is 4 months later, 6 months after. You can see how the eyebrow has picked up. You can see the improvement outside of the eye near the crow's feet. I'm going to turn it back over to Dr. Hines as I get ready for the demonstration. He's going to talk to you a little bit about expectations, talk a little bit about the setup of the treatment.
I wouldn't recommend a treatment that I haven't had myself. So Dr. Momeni and I both have had this treatment, and I will tell you that it does sting a little bit during the procedure, but it's really not really too bad. When I did it, I just took a little Tylenol or maybe ibuprofen, and really that was about it. And the best way that I describe this procedure is when patients come into the office is I will actually pull up my pictures from 3 months ago, and then I'll stand there in front of them and they all go, "Oh, sign me up." You should have seen how bad I looked. No. But it is really pretty remarkable in 3 to 6 months the differences that you can see. How long does it last? As I said to you before, the collagen that is replaced is permanent, but everyone ages differently. And how long it takes before you would need another treatment or a refreshing treatment just depends on the patient because of continued aging. Some people come in for touch-ups. Other people are thrilled and happy with the results and never have to have anything else done. Can you guarantee improvement? As Dr. Momeni said, I wish we could guarantee improvement. But since it's not surgery, we depend on the body's own response to build collagen. When we do surgery, our results are more predictable. We know what we can expect to achieve. With Ultherapy, it's a little less predictable. But I think that's why this is a great procedure for people that are not interested in surgery. As Dr. Momeni put it on in some of the before and after pictures, some of those results I thought were amazing. For someone that would never have considered surgery, that they could get a result like that. But if that patient had come in and wanted surgery, I may not have been as happy with some of those results. Does it hurt? The comfort threshold depends on the patient. But most people, just Tylenol or collagen is all that is needed. It's usually like a little stinging feeling, a little heat that you'll feel, but the energy and the discomfort that you feel means that you're actually getting some treatment, that you're actually getting depositing of this energy in the deeper tissue. So no pain, no gain. If you can feel something, you know that it's working. The costs of these treatments. It really depends on what areas are being treated and how much time is going to be spent. The range is, again, between $750 and $4,000. I'm going to go over a diagram at the end, and it kind of lays out exactly what areas that we would treat, how long it would take, and what the cost would be. At this point, I'd like to introduce Mary, one of our nurses who's gracefully volunteered. And she's going to come up, and Dr. Romeni is going to perform a treatment and demonstrate on her with the help of our esthetician, Melissa Galloway.
So what we usually do in the office as a sequence of the treatment is when a patient comes in, we confirm with them again the area that we're going to treat. Then I go through the individualization of the treatment that I talked to you about before, because not everybody's face is the same, not everybody's aging pattern is the same. We have to target the areas that we need to treat. So what I usually go through is, let's say that we pretend that Mary's kind of signed up for a lower face treatment. Remember that starts about the middle of the face and it stops underneath the chin and the jawline. I'll mark out those areas. I'll go through the pattern of treatments, and I'll try to design and individualize and customize a treatment for what Mary needs. Melissa Galloway, who's our licensed esthetician, actually carries out the treatments. The actual treatment, which I'll show you here, involves basically looking at the screen so that you determine that you're exactly at the safe level, and then you deliver the ultrasound. So that's very mechanical, and it's very slow. So what every patient who's thinking about Ultherapy should know is that at a minimum, you're spending about a half hour doing this. This is not a quick 10-second Botox injection. And for the treatment that I had or Dr. Hines had when we did our lower face areas, we were there for about 2 hours of slow, one-by-one, meticulous lines. We're not going to put you through 2 hours treatment tonight, so we're just going to demonstrate a couple of lines because I wanted to make sure that you know how the safety device works. And usually what we do is we make sure that patients have taken some Tylenol or Motrin. That's about all patients usually need. I took Tylenol and Motrin because I'm a little bit wussy. And I did just fine. And we haven't had a patient jump off the table and say, I can't do this, but I will tell you that it's a little bit uncomfortable. Pain is good. Pain is how you know they're actually delivering energy to the skin. If it doesn't hurt at all, I'm always thinking as a surgeon in the back of my mind, is this really doing anything on the inside or no? So in fact, the pain is a sign of that initiating heat that is going to set the collagen chain in action. And towards the end of the treatment, most patients, including myself and Dr. Hines, we really didn't have any side effects to show. We've done about 100 treatments with this now over the past few months, so I can share some unusual experience with you. We've had a couple of patients stay red for about an hour or two. We had one patient several weeks later still complained of a little tingling around the site. I'll show you exactly why I think that was. But all of those things over a couple 100,000 treatments that have done Ultherapy over the world have been shown to be temporary. So nobody has really had any permanent side effects with this that I'm aware of. So let's go to Mary. This is the only time that a man can respectively use some lady's makeup. So we usually use a little eyeliner here to try to decide what we're going to do. Now, Mary's perfect. She doesn't need anything. But usually what I do is I have a patient sitting up. And what I'll do is I'll draw out where I think the jawline is. Remember that when we lie down, the jawline changes its position. Next thing I'll do is I'll draw a line from the middle of the ear over to about the corner of the mouth. There are a couple of areas of the face that as surgeons we know are very critical in terms of avoiding nerves that are underneath the skin. Remember that the device can go up as far as about 4.5 millimeters. That's about 1/5 of an inch in. So anywhere that I know a nerve may be 1/5 of an inch or less within the skin, I do not want to treat with Ultherapy. So one of the nerves that comes up is usually in this area. So typically what I'll do is I'll follow that anatomic pattern and drop a little vertical line down. And because the Ultherapy device delivers it in inch-long, and I'll show you the device handpiece in a second, delivers the energy in inch-long lines, usually for most patients, unless they have a very wide cheek, we need 2 rows of Ultherapy treatment underneath. Now, a lower face treatment includes not only the lower cheek area, but also the area underneath the chin. So the next area that we go is this side. Clearly, we would be doing this on both sides, but here I'm just demonstrating it on one side. And underneath the chin, where the platysmal muscle is, almost always needs a little treatment. And we have the same pattern of markings on this side. Some patients decide to add the neck to this. So if you look at your brochures, you'll see that there's also an extra hour or so some patients spend to put the neck add-on. The neck add-on would add everything that you see between the area under the chin all the way down. So if you look in the mirror and you're also kind of dissatisfied with this area a little bit, that's above and beyond what we ordinarily do for the lower face. We add a little bit of time and a little bit of a cost to it. All right. So Mary, go ahead and lie down, please. Now I'm going to try to position myself so that the camera can pick up a couple of things for me. So first thing is the handpiece that I'll show you. And this is the handpiece that we use to deliver the ultrasound energy. Who here has had an ultrasound by show of hands? Yeah, almost everybody's had an ultrasound. Ultrasound is just sound waves. It doesn't hurt at all. The reason this actually creates energy is because the ultrasound you've had when you've had ultrasounds, the sound waves are sent out in parallel. They go out in lines. This device, the magic is that it actually focuses the ultrasound beam so that they all converge together at a single point. And we can choose that single point depending on which one of the attachments we choose. So we'll use a little bit of ultrasound gel. I'll go ahead and turn on my scanner. Now, I know we marked the other side, but just as a demonstration, I'm going to show you on this side so that you can all see what's going on. So we'll give you a close-up of the device itself on the skin, and then we'll bring the camera around and show you what things look like on the screen. And I'll try to demonstrate that I can be ambidextrous here. So if you take a look at the screen here, and I hope that's coming through clearly, you'll notice that there is a green line that runs across the screen. And if you look to the left, I've picked a 3mm handpiece. So what this means is that every time that I activate the device, I'm laying a row of tiny little heat deposits. It's usually 8 to 10 depending on which one we choose. So in the line, we'll putting down a row of heat deposits. Then I'll move my hand up or down a little bit and lay down another row of heat deposits. And you do this repeatedly so that each one of those vertical columns that I showed you will get anywhere between 25 and 40 treatments. That's what makes this a slow treatment. So we'll do one of these little treatments just so you can see what goes on. And if you all kind of quiet down and listen, you'll hear a little zap, 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 zap. You ready, Mary? Mm-hmm. All right. And then the important thing is as I do this, I'm always looking at the screen to make sure that I'm looking at particularly the right treatment. And I'll go down a little bit to Mary's jawline while we have the screen on the camera. And you'll notice that there is a little tighter white line here. That's the bone on the jawline. So we're always looking to make sure that the treatment is not deeper than the bone, not because it's harmful. You can heat bone, but it's certainly uncomfortable. So we would not want to treat anybody repeatedly over the bone. Terrific. I'm going to turn it back over to Dr. Hines, who's going to go through a couple of last slides as we finish up.
Some patients that come in that don't want necessarily to have a Botox treatment to elevate their brows, but they want to get more lid, they want to see more of their upper eyelids, then we would just be treating the eyebrow in that area there. And patients that want to treat the entire area around the eyelids, the brow, the crow's feet area, and the area underneath the lower eyelids, as Dr. Momeni demonstrated before, that would be what we call an upper face treatment. I would say that 90% of our patients have a lower face treatment, and that's what Dr. Momeni was drawing out on Mary. That includes the lower cheek, the jowl area, and the area just underneath the jawline. And you can see that's the area that he had marked out, and this is, again, the area that we try to avoid. In patients that want to go down further and treat all the way down to the collarbone, that would be a full neck treatment. And that can be done in conjunction, not necessarily, it can be done separately or in conjunction with the lower face. And again, if it's done with the lower face, we would call that a full face and neck treatment, as in this slide here. So again, the cost depends on the time, because this can be very intensive in terms of the time involved. So that's how we determine the fees. This is a very busy slide. I'll let you read this on your own, but it just kind of goes over the different areas that we treat and what you can expect the first week, the second week, 30 days, 60 days. But in general, it does take about 3 to 6 months to see that reformation of collagen and tightening. So again, the day of the treatment, we recommend that you take some Tylenol or Motrin. Be prepared to be there for at least a half an hour beyond what you're scheduled for your treatment, because we do take very detailed photographs beforehand, so that when you come in 3 to 6 months, we can compare that, what you look like to your preoperative photographs. Dr. Romani or myself will mark out the patient for their treatment, and then Melissa will actually perform the treatment after we've marked it out and set the exact settings that we want. And hopefully you're home for dinner or lunch, depending on what time your treatment is. There is no aftercare or restrictions, and we will make a follow-up appointment before you leave at 3 months for your photographs and for re-examination. How to schedule your treatment. If you are sure what you need, just call our office, and based on the diagram that we've given you, and you can set up our appointment. Just tell them the exact areas that you want treated, and then they will set up the appointment for you. We do require a $500 non-refundable deposit just because of the amount of time that we have to allot in our schedule and Melissa's schedule for the treatment. And then the balance of the cost is due on the day of the treatment itself. If you're not sure about which areas that you want treated, we totally understand that. We don't expect you all to be plastic surgeons. But if you're not sure, you're welcome to come into our office for a brief appointment, and we'd be glad to evaluate the area. However, if you do want to come in and you're not sure whether you want to have surgery or what the other options are, that would be a full consultation, and then we would spend about 45 minutes with you, and that is a $125 consultation. If you do proceed with any type of surgery with us, we, of course, take that fee off of the surgery, but we don't take that fee off of an Ultherapy treatment.
We're going to hang around a little bit here just to chat with you and answer any general questions you want to have. I'll start with you.
Unfortunately, it's not a good treatment in that area. Usually we'll recommend a filler or a Botox, one of those two, for those types of lines. But because of the nerve endings and in that area, we would not use Ultherapy on the upper and lower lip. We usually would treat the crow's feet, which are the laugh lines on the outside of the eye. We would treat the eyebrow itself to give it a little bit of elevation, and then a little bit of the skin underneath the lids where you have a little bit of wrinkling. It does not address the fat pockets or anything like that. That's eyelid surgery, but it does give a little tightening to the skin underneath.
This device was FDA approved in the US in 2009. So I should have said this probably beginning on. Dr. Hayes and I are skeptics by design. So not everything that every marketing company comes around are we willing to put our reputation and put the weight of the group behind. So believe me, we've been waiting for something actually functional to come around. This device has been in the US since 2009, but before that, for several years, they were actually in Israel and Europe. So they have a very long track record as a company. And I think in the space of a lot of companies that devices for non-surgical treatments, they tend to be one of the more reputable and one of the more honest companies about what they do. And they're very good about sharing their data. And so we felt that with their track record, we were ready to offer it to patients of the group. Our track record is that we've had it for about almost 4 months now. So we're actually starting to see our patients from the initial couple of months of treatments come back at 3 months or so. And I gave you before the FDA data, which was 90% of patients were pressing the like button and 10% were kind of so-so about it. I haven't had a single patient, I don't know if Dr. Hines, I haven't had a single patient tell me they were unhappy with the treatment. So I hope that in a year or two, I'll say, with confidence, I personally have done much better than the FDA has. But I can't really in honesty say that now. So it's better that I just present you the total data and I'll tell you what the machine does and let you be the judge.
Has no effect on the skin whatsoever. It only works on the deeper tissues.
It has to be under control. So if somebody has what's called pustular acne, if they actually have infected acne sites, we would not do this treatment. But as long as it's under control and a dermatologist is given they're okay, usually it shouldn't have much of an effect. Because remember, this bypasses the surface of the skin. We're just kind of jumping through and going down 3 or 4 millimeters deep. There's a list that we always give to patients, and I can go through all of these, but it's going to turn quickly into a medical talk. But one of the things, for example, is you've had nerve injury on the side that we're treating. We will not want to treat it. If you have migraines chronically that fire around the eyes, you would not want to do an upper face treatment. It's okay to do a lower face treatment, but you would not want to fire around those areas. If you have a history of shingles that are active once or twice or 3 times a year in a particular area, you do not want to treat that area. This list is very long. But this is why we always give you the medical evaluation form when you come in, and we go through that.
We also usually recommend that you're off of blood thinners if possible, because you do get more bruising sometimes with this treatment. It is an excellent procedure because a lot of times someone that's younger isn't really a candidate for a facelift yet. So what this will do is we'll buy some time. So it does help you get some improvement without having any type of invasive surgery until you're ready to have a facelift or need a facelift.